Okay, we're back. Thank you for joining us. This is going to be our final interview of HIMSS 2010. Thank you for coming this far with us. And I think we've saved, one of the more innovative and interesting speakers for last. I'm with Dr. Peter Hudson of Healthagen, who's got a new product available on Android platforms, available on the iPhone App Store, called iTriage. And can you tell us a little bit about this product?
It's a consumer technology that people can use on their smartphone through the iTunes Store or the Android Store. They can use .mobi browser by going to iTriageHealth.com. They can use their web browser on their computer by going to iTriageHealth.com. And then we have integrated content solutions as well for hospital systems as well as healthcare retail sites. The product essentially helps consumers think through the process of what could be bothering me, and based on what could be causing that symptom, where should I go? And so we've built a very comprehensive medical platform on the front end that brings people from symptom to possible causes. And then we've married that with about 1 million data points on the back end that are all geocoded. So wherever you are, whatever plane you step off of, wherever you live, you can find the doctors around you, the urgent cares, the retail clinics, and of course the hospitals and emergency departments.
Now, I know in my experience in the emergency department, and I think for many of our people following along, we've all seen that patient that has, Googled their symptoms, and they come into the emergency department. They say, I think I have cancer, and really what they do is that they have a sprained elbow. Does your app prevent that, or at least mitigate that from happening?
It's interesting. Every community has, probably a name for people that come in with volumes of information they've printed from the internet about conditions they're worried about. The bottom line is people get worried about a symptom they're experiencing, and they don't have a methodology to think through and a system, or what we call a taxonomy of symptoms to diseases to think through. And so we provide a structure to help patients do that in really the same way that we as physicians are doing it. So, my own personal opinion is people need to get more empowered about their health care. They need to get more educated. We learn about reading, writing, mathematics. We learn about geography in school, but we don't learn about our body and the causes of disease and the symptoms related to them. So I think it's really important that that technologies like ours exist and empower people to think through things in the same structure that their doctors are doing it.
Do you think, does your app give a differential diagnosis, or at least tell them that, a muscle strain is a lot more likely than a rare disorder?
It does, and in fact, based on the condition you think is causing your problem, we help route you to the right medical provider. So, for example, if you think you have a back strain, you can probably see anyone from your primary provider to a retail clinic like Take Care Health or Minute Clinic, to an urgent care in your community or your emergency department, and you can make the decision on which one is best. If you think you're having a heart attack or you have severe abdominal pain and need the tests that can only be done in a hospital system, and you may need admission, then an emergency department is the appropriate place to go. And so we help direct traffic at that decision point.
Yeah, and it's location-based, and it seems to take into account who's a stroke center, who's a trauma center, and who's a Minute Clinic, that kind of thing. Is that right?
Yeah, I think the bottom line is healthcare facilities are spending millions of dollars a year to build not only the capital expenditures to put in a cath lab or a trauma suite or a new operating room. They're bringing in specialists to support those endeavors, and patients don't know anything about them. So, if your hand goes numb, do you want to end up at the hospital that has a stroke center? Regardless of what the cause is, if it is a stroke, you'd like to be at the best place. If you had a head injury, you'd probably like to be at the trauma center near you. So we allow, through our system, hospitals, urgent cares, retail clinics, and even individual physicians to share data on what they do well with the consumer who's actually using it right at that point in time to make a decision.
And now you interface with actual hospitals and emergency departments and clinics too. You can work with them to advertise their services. Is that right?
Absolutely. They integrate with their links to their website, their marketing videos or videos about the care services they provide, different data points on the things that they do well in their hospital, all the way down to streaming live ER wait times into the application right at the point of care.
So if some of you aren't familiar, there are EDs. I heard like Bridgeport, Connecticut is now broadcasting on Twitter their wait time. Obviously, they'll take the stroke first. They'll take the STEMI first. The wait time is not like a set in stone thing, but you're capturing that information and passing it on to the user on the iPhone or the Android.
We are, in fact, in over 50 hospitals with Hospital Corporation of America. We have RSS feeds coming into our system and populating their listings. So if you look for an ER in certain areas of the country, you'll see live ER wait times feeding into our system, and you can make a decision on whether you go to a hospital that has a known wait time that they're publishing and they're going to stand behind, or one that hasn't engaged in the system yet. So that's, we're trying to create transparency for the consumer, and by doing so, create a more efficient healthcare system.
And I'm guessing from the hospital's bottom line, from your bottom line, it doesn't hurt that the average smartphone user probably has insurance.
Yeah, the average smartphone user is $94,000 in income or greater. They work longer. They probably take care of themselves and follow up with healthcare recommendations a little bit better. And a recent study just showed that 23% are interested in using it to find hospitals, 36% are interested in finding doctors, and our population with iTriage is 90% commercially insured.
And so if they are looking for some subacute provider, they have a chronic back pain or something like that, and two providers, are available, they're both a couple miles away, you would send them maybe, or you would give preferential listing to the vendor that you have, the provider that you have a business relationship with. Is that right?
We have 1 million data points, so there's a lot of doctors and a lot of hospitals that can contact us to participate in the system. Really, it's just about providing information to the consumer so that when they use this technology, they know what they're going to get when they arrive and what you do well. So, if you've worked hard to have, a hand center and have hand surgeons on call, and you really want to be a care center that emphasizes that type of surgery, that's something you can publicize to people. Same thing with stroke centers, same thing with, critical care specialists in your hospital. Whatever it is that you think you do well, our message is that consumers actually want to know and want to use to make decisions on where to pursue healthcare.